What's up everyone? My name is Christine and I have common variable immune deficiency, aka CVID. Today I'm going to be talking about CVID and dental hygiene. One of the first things I remember when I was diagnosed was my immunologist recommending for my mom to buy me an electric toothbrush, and he was very adamant about making sure that I went to my regular dental checkups. Well, my mom didn't buy the electric toothbrush, but I did always go to my regular dental checkups. And when we told my dentist about my immune deficiency diagnosis, she had recommended that I go every 3 months instead of every 6 months, and she said that it would be covered because it was for a medical reason. However, I soon went away to college after my diagnosis, and going to the dentist every 3 months just became impossible, and I got back onto the routine of going every 6 months for a checkup, and she never had me change it after that. Having dental issues is a common trend that I do see on the internet with people who have CVID or different type of immune deficiencies, and I will say I have had my fair share of cavities. I've had 3 root canals, and it's not fun at all. CVID related or not, I have sensitive gums, I have sensitive teeth. I, for many years, have had to use the sensitive brand toothpaste, otherwise my teeth are very painful, and I think I brush my teeth too hard because a lot of times I get sores on my gums. The dentists have looked at it, it's fine, it's not like something that needs to be treated, but I think I'm just brushing too hard. So I decided this week to get my first electric toothbrush in hopes that it'll keep my teeth cleaner and that it will help prevent some of those sores on my gum that I seem to be getting from likely brushing too hard. I went ahead and chose the Fairy Wheel toothbrush. I ordered it on Amazon. One of the reasons why I picked this toothbrush was that it had 5 different modes, which I like, including one of them being sensitive. So given I'm prone to like gum sores and sensitive teeth, having a sensitive mode I thought would be pretty good. So I got the toothbrush a few days ago. On first glance of looking at the box, it kind of looked like a vibrator, but it's a toothbrush. So anyways, this is what the toothbrush looks like any electric toothbrush. This type of toothbrush charges with a USB cable. It doesn't have the adapter, but anyone that has a smartphone nowadays probably has an adapter for a USB cable. If you don't, it's something that you can easily pick up in a store. So yeah. This is the toothbrush. Turn it on. You have your 5 different settings that you can switch through. The first thought I had using this toothbrush was I gotta get used to the vibrating feeling on my teeth and not drooling all over the place while using it. It is convenient. It lets you know after every 30 seconds so you can switch the quadrants in your mouth. So far, it seems to be pretty good. My teeth might feel a little bit cleaner. I do intend on giving an update on how I feel in probably about 2 weeks to see what's going on with this toothbrush, if I still like it, if my teeth still feel good, if I notice any significant difference. When I decided to make this video, the scientific part of me was wondering if there is any research out there for people that have immune deficiencies and dental issues. So I decided to do a quick little look and I will let you know what I found. So we're going to be talking about 2 different articles. The first one is from the Iran Journal of Allergy, Asthma, and Immunology. It was published in December of 2011, and the title of the article is Oral and Dental Health Status in Patients with Primary Antibody Deficiencies. The results of the study was that they found that patients who had a primary immune deficiency had higher rates of oral manifestations when compared to the control population or people who don't have an immune deficiency. The article also went on to say that people with immune deficiencies had a higher rate of dental cavities and dental ulcers. I also found an article that is a little more recent. It was published in 2016. It was published in the Brazilian Dental Journal, and the title of the article is Salivary Immunoglobulins in Individuals with Common Variable Immunodeficiency. One of the results of the study was that they found that those individuals who have CVID had a higher rate of having dental cavities and gingivitis when compared to the healthy individuals. This article also did go on to say that about half of the CVID patients used were on broad-spectrum antibiotics at the time of the study, and they found there was no correlation between the use of antibiotics and the absence of periodontal disease. This article also did mention, which is something that I never even thought about but does make sense, is the fact that those with CVID are more susceptible to respiratory infections. And because we are more susceptible to respiratory infections, that means we're more likely to have pathogens in our oral cavity because of the connection from our lungs to our mouth. Both of the articles really just went on to say, which confirms what my immunologist first told me when I got diagnosed, confirms what my dentist told me when I first got diagnosed, and it's that maintaining good oral hygiene is very important. Getting your regular checkups with your dentist is very important. Alrighty, so an update on my thoughts with my electric toothbrush. It's been a little more than 2 weeks. It's probably been more like 6 weeks by now, but I'm very happy with the purchase. I have gotten used to the vibration feeling on my teeth. I don't even think about it anymore. I actually forgot about that until I was editing the video that I had made of my initial reaction. I still do have an issue with the drooling though, and trying to not get my spit and toothpaste all over my clothes in the morning, so I'm working on that. But overall, I do feel like my teeth are cleaner. It's a noticeable difference. Whether they actually are cleaner or not, I guess I can't make that assessment because I'm not a dentist. But it does feel cleaner. I'm very happy with the purchase. It's much easier to get like in the corners and harder to reach spaces in your mouth, and you feel like you are getting a more thorough job. I have not gotten any sores on my gums since switching to an electric toothbrush, which has really been amazing. Very happy with that. I wish I had done the switch sooner, but yeah. I definitely enjoy using an electric toothbrush. That's it for today's video. I hope you enjoy the rest of your day wherever you are. Bye!